Jai Gurudev. Hello everybody. I'm Dr. Shraddha Singh Tamkar from Sri Sri Tattva, Panchakarma Physiotherapy Department, and I'm heading this department of physiotherapy. Physiotherapy has three aspects basically. One is exercise therapy, one is hydrotherapy, and one is electrotherapy. And exercise therapy is dealing with exercises or any special manual techniques. These days manual therapy is also very much appreciated. So all manual things and exercises come under exercise therapy. All treatments that we carry out with different gadgets or equipments, like using ultrasound for treatment, using interferential currents for treatment, using laser for treatment, they all come under electrotherapy. And the third part is hydrotherapy. Whenever water is used for treating something, it is called as hydrotherapy. Anybody, physiotherapy has a very wide range of treatments and from age groups of day 1 to the last day of life. And because it covers so many ailments and health conditions in people, and even I think before birth also, because we have antenatal therapies also. For any specific illnesses, it varies from 5, 7 to 10 days. If there are some chronic issues like very chronic arthritis or something like paralysis, then it may take a longer time. We have home treatment plans also. Like if somebody comes for treatment here or cannot come for regular treatments and has a one-day consultation, and we can even give him home exercise plan or home therapies. General benefits of each of exercise therapy gives good strengthening and endurance to the muscles and bones, joints, and hydrotherapy is for relaxation, pain relief, and increased circulation. Then electrotherapy for good healing, increased circulation, increased joint of range of motion, and healing from the illnesses. There is a wide range of ailments that we cater, as I told you now, and our department is fully equipped with exercise therapy. We have expert doctors giving customized exercise plans also, and they are experts in manual therapies also. And electrotherapy, we have a full-fledged electrotherapy department which has various equipments from wax bath, infrared, ultrasound, shortwave, interferential therapy, tractions, laser, and also additional fitness equipments also, and equipments for weight reduction and general strengthening also. And hydrotherapy, we have contrast baths, we have whirlpool baths. Yes, physiotherapy treatments go in two ways. One is inpatient and one is outpatient. If somebody wants to visit the clinic department and have treatment and go back home, that is possible. If somebody wants to stay back and take treatment, that is also possible. We have stay arrangements also. And if somebody is coming up from far off places and has mobility issues specifically, like in paralysis or like in severe arthritis, where walking or much strain, physical strain is not allowed, we have facilities for that also. Physiotherapy has a very wide scope. Like, see here, I have our brochure pamphlet. We have geriatric care, that is for... See somebody walking, you see? As we grow old, there's a difference in our walking pattern, no? Because of knee pain or back pain or the heel pain also. So that is called geriatric care. So we have therapies for geriatric care, old age issues, health issues, and pain management that goes for all ages. Pain from any injuries, pain from wear and tear of the body, pain from any stress. Basically musculoskeletal pains we treat on a wider range. Any joint pain that can come under pain management. Then we have women's health care. In this we specifically deal with adolescent phase, pre-post menopausal, and antenatal and postnatal. These are the three phases in a woman's life where so many changes happen in the body, and if not taken care at this time particularly, the in-between ages suffer a lot. That's why women's healthcare. And then we have child healthcare, in which we take children from even day 1 to their adolescent age. And in children's healthcare, we have cases of delayed growth, delayed milestones, then cerebral palsy with mental retardation, then for small age groups or teens, postural care. Posture care is very important these, especially with all the use of gadgets that have come. Then we have flat feet or knee. You see sometimes the shape of the knee is going outwards or inwards. It is called as bowing of the knee or genu varum and genu valgus. We treat those cases also. And flat feet is another very common issue these days, specifically because of very poor footwear. All the footwear that children are using, fancy type of footwear, is really not good for health. And if you randomly pick up 5 or 4 out of 10 children have flat feet these days. And then this causes pains in later years, so it should be taken care of now only. Then we have our expertise of physiotherapy in orthopedics, neurology, pediatrics, musculoskeletal, gynecology, cardiothoracic, geriatrics, occupational health, sports injuries. We have taken up many cases of sport injury also. We have in-house football team also from our own place residents, and we have been treating them also. And in sports, we have agility exercises, endurance exercises, and strengthening exercises as well. Then general exercises, general fitness exercises for all, and exercise therapy for pains and aches, and electrotherapy for pains and aches, and also personalized health problems. And our treatment, electrotherapy, as I said, very well electrotherapy department, and exercise therapy for improving agility, for improving flexibility of muscles and joints, for preventing complications of injuries, and graded strengthenies for improving the activities of daily living, ADL. For any program, ADL is one of the main focus. Like for a person, whatever he is doing in his daily life should be very smooth functioning. For somebody who is managing a hotel, his activities of daily living are different. For somebody who is a surgeon, his activities of daily living are different. For somebody who is an IT person, his job requirements are different. So we have customized exercise plans also for all these different varieties. And this is all the facilities that we have. Yes, special packages for different ailments. Again, the treatment varies from 5 days, 7 days to 10 days. And we have special packages for different age groups and different specific disease oriented. Like sometimes we declare spine month, arthritis month, and in that we have a week-long or 10 days packages for all these therapies, specific disorders. November is declared as Spine Care and Arthritis Care Month, because World Arthritis Day and World Spine Day happened to be just recently. So we have declared this month specifically for spine ailments and specifically for knee joint or arthritis issues. Yes, we have lots of things for corporates and specifically for the type of work they are doing. It's most of the sedentary lifestyle with no good lifestyle pattern, because they are denying the body clock and working at nights or overworking in the evening hours, which is really not good for health. And we have specific exercise plans for them, and we have specific joint packages also for them. And in between we conduct camps, health camps for corporates, where we go to different companies and hold a week-long camp for them, which includes electrotherapy as well as exercise therapy. And these are very friendly packages, and about 1 hour if person spends, and we have group therapies also, group exercises also. In 1 hour, 7 days, if they spare 1 hour for 7 days, they can regain health. Hospitality and ambience, of course, play a very big role. We have a very wonderful ambience here, and the moment you step in, stress is released. That also helps in healing, and very good rooms and specific attention personal attention and privacy also at the same time. And we have a well-equipped gym also. So health and fitness is also take care. And we are also planning to extend our services to an outdoor gym also, where exercises for general can also be carried out. And stay facilities are also very good. We have very good inpatient care or in-house care here, and we have doctors also who are attending to any need of emergency also. Yes, corporate, and I think that is the need of the day. We have started corporate packages also. They can come and stay for 1 week or 10 days, 5 days, 7 days, 10 days as per their time, and they can avail these therapies as relaxation, as preventive and as curative. And they can have some group exercises, they can have individual exercises and some therapies that go along with their specific needs. Yes, very true. Many of them are getting their knee replaced, but we have only one spine. Knees are two anyway. So what I think is that food habits, poor lifestyle and less of exercises is one main reason that people go in for surgeries, because they've not taken care of these 3 factors. And I would suggest that they take treatments. Our treatments are helping them to avoid surgeries. We have had wonderful results on this, and for those who are viewing, I would just suggest a regular walk from early age and good food habits and good rest, and specific amount of rest at specific time is what we need to keep our body fit. And those who want to avoid surgeries, if you have been told for, they can definitely visit us, have our expert consultations and go in for some specific treatment packages. The duration and the frequency will depend on the particular case. So when somebody comes and we consult, only then we can decide the specific duration. But in general, 10 days is a good time to come and take treatment. And for chronic illnesses or for very severe cases where immediate surgery has been advised, 15 days minimum therapy is advised. But you can definitely avoid surgeries in most of the cases. Once a year if they are of a middle age group, and if they are little senior citizens where degenerative changes have already occurred, maybe twice a year. But again, specific we can tell only after examining them thoroughly. All are welcome, all those who need to take care of health and consider health as a precious gift, consider their body as a precious gift, they all are welcome here. And to conclude, I will just quote something from Gurudev's knowledge. Gurudev always says, Gurudev Sri Sri Ravishankarji, he always says that health is not a mere absence of disease, but it's a dynamic expression of life. So live life to the fullest. Jai Gurudev.